Hi everyone, and welcome to another episode of the Fibroid Doc, where I am committed to helping women with fibroids live a life with reduced bleeding and pain and improved fertility. And today I am going to tackle this question: how do I know if my fibroids are cancerous? Okay, this is often on a lot of patients' minds because they're diagnosed with a fibroid, and the first question that comes to mind is, "Oh my goodness! Like, how do I know that this is something not dangerous? How do I know that this is not cancerous? How do I know that I don't have to remove it right away?" Okay, so I'm gonna go over some important points regarding this question, which is a very important one. So, first of all, endometrial cancer or cancer of the uterus is one of the most common gynecologic cancers, and that about 66,000 women every year in the US are diagnosed with endometrial cancer or cancer of the uterus. Often, this is actually of the lining of the uterus and not really the smooth muscle. And fibroids are smooth muscle. Okay, they are smooth muscle tumors of the uterus. And these, the most common type of cancer here is called leiomyosarcoma. So, cancer of the smooth muscle. And this is luckily less than 4% of all uterine cancers. Okay, so it's about, the rate of smooth muscle cancers of the uterus are about one in anywhere 350,000 to about 1 in 1,000,000 women. So it is really rare. Okay, so that's good news. So the first point I want you to remember is that most fibroids are actually benign, and the rate of smooth muscle tumors, or that the fibroids actually being cancerous, are extremely rare. Okay, the second point is we never really can diagnose whether a fibroid is truly benign or cancerous unless we remove it. So a lot of patients will say, is there any way we can just biopsy it from the outside and figure out if it's cancerous? And then if it's cancerous, fine, I'll, have a myomectomy or a hysterectomy. Unfortunately, this is not possible. If the fibroids are truly in the lining of the uterus, then we can put on a camera and, remove it, scrape it, biopsy it. But if they're really in the wall of the uterus, there's no way to really quickly biopsy it from the outside. You just have to take it out. So if your suspicion if your suspicion and your doctor's suspicion of cancer is high, then the best route is really just to take it out, send it to the pathologist, and then you'll know for sure. And then you don't have to worry about it. So that's point number 2, is that there's really no way to know unless we take it out. And certainly, as soon as you're diagnosed with a fibroid, doesn't mean you need to rush and remove it, but you and your doctor can discuss how you may want to monitor it over time. So for some people, that means getting an ultrasound every 6 months. For other people, maybe, getting an ultrasound every year. If you've had fibroids for a long time and they're about the same size over many, many years, then, just a pelvic exam every year may suffice. So you want to discuss with your doctor how you exactly want to monitor it. But there's no way to 100% say if it's benign or cancerous unless it's removed. Okay, and lastly, warning signs. I wanted to go over some warning signs of fibroids, potentially being cancerous. And there are a couple of key ones. One is rapid growth. Okay, so if your fibroid was the size of a lemon or a plum, and a year later it's the size of, a pineapple, well, that's troublesome and that's worrisome. So rapid growth is often a sign that it doesn't mean that it's 100% cancer. I've definitely seen fibroids go very quickly and they're not cancerous, but that's it's something to think about and something to really pay attention to and see your doctor right away if you feel like your fibroid is really growing fast. And number 2, bleeding and pain, especially postmenopausally. So when you hit menopause, fibroids should actually, calm down a little bit. They should really stop growing. Oftentimes they even shrink. So if at that point, you're 60 years old, you've already reached menopause 10 years ago, and now your fibroids are causing you pain, they're causing you bleeding, that's again something to take to your doctor right away. Okay, so the three main points that I want you to remember: number one, most fibroids are actually benign. Number two, there's no way to really 100% say if a fibroid is benign or cancerous unless it is completely removed and sent to pathology. And number three, the warning signs of the fact that fibroids may be cancerous are extremely rapid growth and symptoms of bleeding and pain, especially after menopause. So I hope you found this video useful. Please tag a friend who may have fibroids or who could use this information. Please subscribe to my YouTube channel and follow me on Instagram at TheFibroidDoc for more important info about fibroids. Have a great day, everybody. Bye-bye.